Good afternoon, top rankers, guests, deans, coordinators, and all the students who are here via Zoom and via Facebook Live. Welcome to TopRank Review Academy's free lecture series for nursing. This is Caroline Palais, and I will be your host for today's event. Guys, this is in part of our Bayanihan Review Assistance Program, wherein we are providing free review for our students through Zoom and via Facebook Live. We also have upcoming free review crash course / final coaching for veterinary board exam review, and this will run from the 28th of June until July 27, 2021. So if you know anyone who's interested, please do advise them to just send us a message through our Facebook fan page. We'll also launch the free pharmacy board exam review crash course and final coaching, which will start tomorrow, May 29th, and this will run until June 25. If you know anyone who's interested, please do advise them to send us a message. We'll also have a psychometrician free lecture series on June 23 until 26 via Zoom and Facebook Live. And on June 4 to 8, we'll have another lecture series for respiratory therapy. For the benefit of those who doesn't know TopRank Review Academy yet, let me run you through our company profile. So guys, TopRank has started in 2013, and right now we're already considered as one of the biggest national review centers here in the country. We already have 20 local branches and 4 international branches. For our local branches, we are located in Manila for our main office. We're just right in front of PRC in Moraita. We're located at the 5th floor of the Don Lorenzo building. For our Metro Manila branches, we also have branches in Quezon City, Marikina, and Caloocan. For our provincial branches, we are located in Lawag, Baguio, Dagupan, Nueva Vizcaya, Tuguegarao, Bataan, Bicol in Legazpi and Naga, Cebu, Iloilo, Tacloban, Calbayog, Davao, Bacolod, Zamboanga, up until Coronadal, South Cotabato. And what's good with our online interactive review is that we could reach the farthest places in the Philippines. We also have branches internationally, and we are located in the Republic of Indonesia, both in Jakarta and in Bandung in Indonesia. So what we basically do there is we provide them international exam review. We also provide them trainings and seminars for their healthcare workers to be more globally competitive. And amongst all the other review centers here in the country, we are the only review center who was invited at the 70th anniversary of diplomatic relations of Indonesia and the Philippines. And this happened prior to the lockdown last year. We also have branches in Dubai and in Abu Dhabi in the United Arab Emirates. So we provide them international exam review as well as IELTS and OET. So for our track record, we don't only offer nursing, we also offer dentistry. Our top 1 came from Centro Escolar University. We also offer licensure examination for teachers. Our top 2 came from University of the Philippines, Manila. We also offer psychometrician review and criminology. Top 1 came from Universidad de Zamboanga. And this is the latest top-notchers from our radiologic technology. This was a launch, or this was announced just recently, just a few nights ago. So we've got the top 1, 3 top 3s, 1 top 6, and 1 top 10 for RadTech. Our top 1 came from St. Louis University in Baguio, as well as our former top 1, also from SLU Baguio. We also offer MedTech, or medical technology. Here are our top notchers for this year, as well as respiratory therapy. These 4 students are also products of our online interactive review. We also offer midwifery and, of course, nursing. This is our pilot program, guys, when TopRank started in 2013. Since Sir Roland Villegas is also a nurse, this is our track record for nursing. So we only had 2 top-notchers when we started in 2013, and it became 3 top-notchers in 2014 and 6. But in 2015 was the first time that we were really well known in the industry because we got 16 top-notchers in just 1 season. And on the same year, we had 20 top-notchers in just 1 season in November of 2015. Here are our top-notchers in 2016 and 2017. And on November 2017 was the first time that we got our first top 1. For our nursing review program, we have Sir Raymond Maniago, who's also one of our esteemed national lecturers. You'll also see him if you enroll here in TopRank. So we got 17 in 2017, and again in 2018, we got another top 1 from University of Pangasinan, Sir Mark Tristan Robosa. And in 2019, we got another top 1 from Angeles University Foundation, Ms. Caceres. And last but not the least is Ms. Watanabe from Davao Doctors College, also in 2019. So who amongst you guys will be the next top 1? Because we already had our top 1 in 2017, 2018, and 2019. And hopefully for this year, 2021, we'll have the next top 1. And because of our track record, we're now multi-awarded as the best national review center here in the country by Golden Globe, Best Choice, Q Asia, Global Awards, and Global Excellence Awards. Guys, we also have books on sale if you're interested to purchase. We have already launched the 2nd edition of our Top Rankers Guide. From 1,350, it's now down to 1,099. But wait, there's more. We are going to have a raffle promo for our event this week. So please do make sure that you sign in our registration form for your chance to win a book of our battle strategies, and this contains around 1,000 board-sensitive questions with Socratic approach to answering rationale and test-taking strategies. So if you guys are interested, please don't forget to register, most especially those who are watching us via Facebook Live today. And the draw will be on the 30th of this month. So please make sure that you are here when we announce your name, okay? So you need to be live or inside Zoom for you to be able to win this book once we do the raffle, okay? So for the review proper, we are still accepting enrollees for the final coaching. It will start on June 8th for the July 2021 PNLE review. So please do send us a message through our Facebook fan page if you would still want to enroll, as well as our November 2021 PNLE. Our start date will be on June 25. We still have an ongoing promo of a 500 peso discount if you enroll until June 1, 2021. For our weekend class, the promo is less 1,000 pesos. Start date will be on July 3rd, 2021. Preferably, this is the class for those who are working. So you can still review while working. We have a special weekend class for you guys. So for more information, please don't forget to like and share our Facebook fan page. It's Top Rank Review Academy.
All right, good afternoon everyone, or good evening, should I say, 6 o'clock na pala. All right, so again, good day everyone. I'm Professor Kenneth Arzadon and I'll be handling your Psychiatric Nursing free lecture for today. So I'll be presenting to you nurses the concept of your schizophrenia, which is one of the favorites of your board of nursing. Okay, so today, as we will be having the lecture nurses, I'll be presenting to you the lecture in schizophrenia the way that I usually present it during the review proper. So we'll be focusing more on the important topics or the most important, most salient points in your psychiatric nursing, particularly schizophrenia now, that you need now for you to be able to pass your board examination. Okay, so I hope everyone is comfortable, all right, watching us, and please stay with us until the end of the lecture nurses, because one of the most important topics in schizophrenia nurses, I'll be discussing that one on the end of the lecture, and that would be your psychopharmacology. All right, there are a lot of updates nurses regarding the medications now that are being used now in your patients with your schizophrenia. Okay, so before we formally start nurses, I know that all of us, most of us, okay, are from different provinces, yes or not? Yes. So again, ayan, so I know that we are bound with a common goal, and that is for you to pass the board examination. Yes or not? Yes. Okay, nurses, ayan, so before I start, nurses, may I just check on everyone? May I just check on everyone? May I request everyone to please kindly open your chat box, or to those who are live with us through Facebook nurses, kindly key in there, I am a top notcher from, then you are going to indicate your school. Again, everyone, kindly key in I am a top notcher, then from, then indicate your school po. Ayan. You can indicate the whole name of your school or the even the abbreviation of your school kung ano pong mas okay sa inyo. Okay, so meron na po tayo dito na una po sa ating Zoom that will be from UST, okay, from Zamboanga University. We also have from Olafo College or de Fatima, Colegio de Dagupan. Okay, we also have from SJCDC. Welcome everyone. From Tacloban, we also have here. All right, BYC MSU from our viewers from Facebook Live. We also have Mindanao State University. Ayan, good day everyone. Welcome po to TopRank Review Center. We also have from Far Eastern University, from HIC. All right, IMCC. Okay, see you Makati. All right, Emilio Aguinaldo. Okay, Ateneo de Zamboanga. Okay, so ano ba? Ayan. Well represented po tayo from Luzon, Visayas, and Mindanao. Yes or no? We also have from Lorma, from La Union. We also have from Northwestern University, Lawag City. We have from Lucena. Alright, sige, ang dami po. Ayan, pasensya na po sa mga hindi ko nabasa, sobrang bilis po ng paggalaw ng ating mga pangalan. Okay, so lumabas po na po yung mga pangalan ng mga top notchers. Yes or no? Yes po, mga future top notchers po natin. Okay? Sige, nurses. So let's begin now with our lecture. Ang dami. Okay, ang dami pong humahabol sa ating Facebook Live. Okay, so may mga students po sa Facebook Live, meron din po sa Zoom. Okay, so I encourage everyone to please participate, nurses. Later on, we will be having some recall. I-recall po natin yung concept po natin. Okay? Sige, nurses, let's formally start now with your topic in your schizophrenia. Okay? So, nurses, please remember, okay, allow me to present to you first, okay, siguro the history, a brief history of schizophrenia para mas ma-appreciate po natin siya. Remember, nurses, for how many decades, nurses, ang paniniwala ng mga tao, okay, if you have schizophrenia, ikaw ay masama or ikaw ay delikado. You are a threat to the society, yes or not? Yes, because if you have schizophrenia, you are violent. Okay. However, nurses, please remember, with the help, nurses, of the various medications that has been developed, nurses, okay, people now with schizophrenia, they have the capability now to live in the community with other people. Pwede silang magtrabaho, pwede silang magkaroon ng ibang pamilya, and that is because of our medications. Okay, later, nurses, we are going to discuss, nurses, the different medications used in the management of your patients with schizophrenia. And I guarantee, nurses, isang tingin mo pa lang sa gamot, nurses, alam mo na kung ano ang gamit nun. Isang tingin mo pa lang sa pangalan ng gamot, alam mo na kung anong klase siya ng gamot for schizophrenia. Be it conventional, atypical, or your third generation. Okay? Sige po. Let's go, nurses. Sige. Allow me to present to you a brief history of schizophrenia before we formally start with our lecture, my dear nurses. Okay? In 1891, nurses, please remember, okay, then the term that was used now to denote now schizophrenia, that is your dementia precox. Again, that is your dementia precox. What is dementia precox, nurses? That is premature dementia. Okay. Kraepelin, okay, before, ang paniniwala niya, okay, pag meron kang schizophrenia, okay, that is your dementia precox, that is maagang pagkaulyanin, that is premature dementia. It was only, nurses, in 1908, okay, that Professor Eugene Bleuler, coined the term schizophrenia. Sir, ano po ba ang ibig sabihin ng schizophrenia natin? That came from the Greek word nurses, schizein, and the Greek word as well, that is your friend. Again, according to Sir Eugene Bleuler, that is now schizein. That means nurses, that is your splitting. Again, schizein nurses means splitting in English, and friend nurses means diaphragm. However, we are using now the definition, and that would be the splitting of the soul. Again, so Eugene Bleuler believed nurses that is schizophrenia, there is a splitting of the soul. Mamaya nurses, malalaman natin what are the different manifestations of your patients with schizophrenia. Because the ego cannot balance the id and the superego. Kaya ka nagkakaroon ngayon ng two opposing feelings. Okay, nurses, let's now proceed with the 4 A's of your schizophrenia. Okay? Sir, ano po ba yung mga 4 A's po ng schizophrenia according to Professor Eugene Bleuler? Okay, hindi na po siya masyadong ginagamit sa mga books, nurses, tong 4 A's. However, i-present ko pa rin siya sa inyo. Baka lang magamit ulit. Yes or no? Yes, and just to give you a brief overview, nurses, kung paano nagsimula ang schizophrenia. Okay. Number 1, nurses, please remember, sabi ko kanina, there are two opposing feelings. There is tawag dito, there is a splitting of the soul or there is a splitting of the mind. Yes or no? Yes, bingo. Ano po yung first A ni Sir Eugene Bleuler? That is your ambivalence. I repeat, nurses, that is your ambivalence. Sir, ano po yung ambivalence namin? Please remember, nurses, ambivalence, nurses, according to Sir Eugene Bleuler, that is now the two opposing feelings. Again, that is two opposing feelings po. Bakit po nagkaroon ng two opposing feelings? Ang patient mo na may schizophrenia, minsan masaya or hindi niya alam kung masaya siya or malungkot siya. Yes or no? Yes, because the ego cannot balance the id and the superego. Yes or no? There is splitting of the mind or splitting of the soul. Yes or no? Yes. And because of that versus another letter A, we have what we call your autism. Again, another letter A in schizophrenia, that is your autism. There is withdrawal from the society. Again, there is withdrawal from the society, autistic. Okay, another letter A, nurses, that would be your abnormal affect. Again, another letter A, that is your abnormal affect. So as we go on, nurses, we will be discussing later on what are the different types of your affect or what are the different abnormal affect, be it blunt affect, be it flat affect, or be it inappropriate affect. And which of these 3 affect, nurses, is more common or most common to your patients with your schizophrenia? Lahat po yan mamaya, isa-isahin po natin yan, mga nurses, mga top notchers. Yes or no? Yes. Okay. What else, nurses? We also have your abnormal association. Okay. Another one, the last letter A, according to Professor Eugene Bleuler, that is your abnormal association. Again, that is your abnormal association. So later on, nurses, we are going to discuss now the positive signs of your schizophrenia. What's the difference between your tangentiality and your circumstantial thinking? What's the difference between your circumstantiality and tangential thinking? What's the difference between your flight of ideas as well as your looseness of association? Lahat po yan mamaya i-discuss po natin. Yes or no? Yes po. So again, nurses, let's proceed now with the discussion. Okay? Sige, nurses, do you hear me loud and clear? Okay, malinaw po ba yung audio ko? I just would like to check. Okay lang po ba tayo? Naririnig po ako? Naiintindihan po yung sinasabi ko? Okay, sige po. Alright, very good. Alright, please let me know kung medyo mabilis ako magsalita. I have the tendency to talk very fast. Okay? Mabilis po kasi ako magsalita minsan. Okay? Just let me know kung, sir, wait lang para, baka, okay. Okay? Sige po, let's go. Clear ko na po ito, nurses. Again, what are the 4 A's? Ambivalence, autism, abnormal affect, and the abnormal association. However, nurses, as time goes by, nurses, dumami na po yung mga manifestations ng schizophrenia. Okay? Let's have now the different manifestations of your schizophrenia. But before that one, okay, we need to know now how is schizophrenia defined in your DSM-5, and that is your Diagnostic and Statistical Manual of your mental disorder. Sir, ano po ba yung DSM-5? Please remember, nurses, this is the taxonomy, or should I say, this is the one that is used now by your psychiatrists now in the nomenclature of your mental disorders. Kung paano na i-code or paano na i-diagnose ang isang mental disorder. That is now the most updated or the pinaka-updated po na DSM po. That is your DSM number 5. Bakit tanong po sa board exam? Okay, tandaan niyo po ha, number 5 na po yung ginagamit po natin na DSM po natin. Okay, that is the most recent. All right. Ano pong sabi sa DSM-5, nurses? Schizophrenia is a severe chronic mental disorder, nurses, characterized by disturbances. Number 1, okay? Number 1, there is a disturbance in your thought. Again, there is a disturbance in your thought. Sabi ng patient mo sa'yo, Nurse, kumanda ka. Parating na ang mga bisita galing sa Jupiter. Is that illusion, hallucination, delusion, or ideas of reference? Sabi ng nurse sa'yo, nurse, may gagamba sa ulo mo. Pagtingin mo, hindi naman siya gagamba, ribbon. Is it illusion, hallucination, delusion, or ideas of reference? Or sabi ng patient mo, kayong mga nurse kayo, pinag-uusapan ninyo ako, may balak kayong patayin ako. Is it hallucination, illusion, delusion, or ideas of reference? Nurses, mamaya, ima-master po natin yan. Why? In the actual board examination, nurses, they are going to present to you a situation wherein the patient now is having this manifestation. And you should know, or you must be able to determine what is the manifestation now that is being presented by the patient. Is it a problem in thought, perception, or behavior? Okay, so stay with me for 2 hours. Okay, another nurses, it is also characterized by a disturbance nurses in your perception. Again, that is also characterized by a disturbance nurses in your perception. And what else nurses? A disturbance in your behavior. Later on nurses, pag-uusapan po natin ang behavioral management for your patients with schizophrenia. Hindi lang po behavioral management for schizophrenia, but all of your mental disorder. What if yung patient mo binumura ka na? What if yung patient mo inaaway ka na? What if yung patient mo astang sasampalin ka na? Or babatukan ka ng patient mo? Ano ang gagawin mo as a nurse? That is now for the safety of all the nurses, of all the patients, and for the patient himself. Yes or no? Yes, this is your behavioral management. Mamaya, i-master po natin lahat yan. Okay? And last nurses, again, sabi ko, that is your behavior. Yes or no? Sige, lagay mo po dyan, that is your behavior. Alright? Sige, nurses, let's continue now with the discussion. Okay? Sige, clear ko na po ito ha. Clear ko na po. If you want to take a screenshot, you may go ahead. In 5, 4, 3, 2, 1, I'll be transferring now or moving over to the next slide. Okay? Sige po. Ayan, may mga sumasagot na po dito sa Zoom po natin. Okay? Sige, later on, nurses, we will be having the lecture more interactive. Okay, mamaya mga questions ako and I encourage everyone to answer now my questions. Alright? Sige po. Okay. So, let's proceed. Ayan. Ayan. Okay. Everyone, go. Let's have nurses the different etiology or the possible causes of your schizophrenia. Before nurses, sinasabi ng mga experts natin, okay, there is something to do now with the relationship between the mother and an infant. However, based on different studies, nurses, hindi po siya napatunayan. So studies now, nurses, are more focused now on the biologic theory that would involve your genetics, your neuroanatomy, your neurochemistry, and your immunovirology. Again, your genetics, your neuroanatomy, your neurochemistry, and your immunovirology. Sige po, isa-isayin po natin. Bingo. First, nurses. According to theorists, nurses, or according to your experts, genetics po, that is passed through the mother to the child. Okay. If one parent, again, if I repeat, nurses, if one parent, for example, is diagnosed with schizophrenia, please remember the infant now or the child has 15% risk of developing your schizophrenia on the later stage of his or her life. But if, for example, now 2 parents were diagnosed with schizophrenia, again, 2 parents were diagnosed with schizophrenia, that will be giving the child now 35% risk to develop now schizophrenia on the later stage of life. Again, that is now genetic. Sir, ibig sabihin na mamana po ba ang schizophrenia? The correct answer is yes. 15% pag 1 parent, 35% pag 2 parent. According to the book of Videback, 8th edition, 2020 na release po. Okay? All that I will be discussing to you now, nurses, are coming from the book of Videback 2020 edition. Kaka-release lang po last year. Okay? That is why I have chosen your Psychiatric Nursing Schizophrenia to be presented today. Kasi ang dami pong bago dun sa libro ni Videback po ng Psychiatric Nursing. Okay? And we must be updated now para maging top-notchers tayong lahat. Yes or no? Yes, lahat po ng top-notchers, pakiclick naman po ang heart button on the bottom of your screen. Everyone, lahat po ng top-notchers, kindly click the heart button on the bottom of your screen. Okay? I love you, top-notchers. Love, love, love lang po tayo. Yes or no? Yes po. Okay? Nurses, let's have naman po the neuroanatomy. Nurses, let's have the neuroanatomy. Sir, ano naman po ang sabi ng experts po natin sa neuroanatomy theory po natin? Okay? Sabi ng mga experts po natin, for patients now with schizophrenia, okay, there is decrease in the level of your cerebrospinal fluid. Again, there is a decrease in the level of your cerebrospinal fluid, and there is also less brain tissue. Again, for patients diagnosed with schizophrenia, there is a decrease in the level of your CSF and there is less brain tissue. But hey, Sir, ano po ba dapat ang focus namin dyan? Bingo. Put a big star, nurses. Lagyan mo ng malaking star, pabaon sa inyo ni Kuya Ken sa inyong actual board examination. The neurochemistry theory. If asked in the board examination, which of the following neurotransmitters are associated in the development of your schizophrenia? Ito po ang sagot ng mga top-rank, top-notchers. Ano po yun, sir? Dalawang neurotransmitters po natin. That is your dopamine. And another one, nurses, that is your serotonin. Again, the two neurotransmitters involved now in the development of your schizophrenia, that is your dopamine and your serotonin. If you want to pass the board examination, nurses, alamin mo, si dopamine at si serotonin. But hey, if you want to top the board examination, hindi mo lang dapat alam ang dopamine at serotonin. Dapat alam mo din if it is increase or decrease. Yes or no? Yes. Question, nurses, ano po ang dopamine po natin or serotonin in schizophrenia? Is it increase or decrease? Ano pong sagot ng mga top-notchers po natin? Sige. Is it decreased or increased po if you say schizophrenia? Ano pong nangyayari sa dopamine po natin as serotonin? Okay? Tataas po ba siya or bababa? Bingo, nurses. I would like to remind all of you that in your patients with schizophrenia, okay, there would be an increase in the level of your dopamine. Again, there would be an increase, nurses, in the level of your dopamine. Very good, everyone, to those who have answered in Facebook and in your Zoom. Ayan, maraming salamat po for participating. That is, nurses, an increase in the level of your dopamine. Again, nurses, an increase in the level of dopamine, also an increase in the level of your serotonin. Mamaya, nurses, i-apply po natin to sa mga gamot ninyo. Okay po tayo dyan, ha? Bingo. Let's have, nurses, your immunovirology naman po. Sir, ano pong sabi ng mga experts po namin sa immunovirology? Bingo. Mataas daw po ang chances or mataas daw po ang cases ng schizophrenia, nurses, in countries with, okay, tandaan nyo to, ha, cold weather, okay, plus meron po silang, ano to, madaming population. Yes or no? Yes, cold weather and crowded population po. Sir, bakit daw po tumataas ang cases ng schizophrenia pag may cold weather and crowded population? Bingo, because of exposure, nurses, to your influenza. Again, because of exposure to your influenza virus. According to experts, nurses, for example, your mother was exposed to your influenza virus during the second trimester of pregnancy. That will predispose the growing infant to develop now your schizophrenia once he grows old. Okay po tayo dyan, ha? Again, neurochemistry. Ano po yung focus namin dapat dito, sir? Sige po, mag-focus po tayo. Bilugan po ni Sir Ken. That is your dopamine and your serotonin. Nakuha po natin. Again, dopamine and serotonin are both increased in your patient with your schizophrenia. Malinaw po ba tayo dyan? Alright? Nababasa po ba yung sulat ko? Okay, sige po. Gawin po natin makulay ang sulat natin para maging makulay ang buhay. Yes or no? Yes. Alright? Sige po. Ayan. Yes, sir. Sabi niya, Sir Ma'am Rose Lacquarin. Ayan. So, shout out po sa inyong lahat dyan. Shout out po sa mga family niyo. Baka nakikinig po si mother or father. Hi po, ma'am. Hi po, sir. Yung kapatid po natin, kumusta po tayong lahat? Alright? Sige, nagre-review po yung anak natin. Ayan. Ang ating masipag na future registered nurse. Yes or no? Yes. Okay, sir. Ano po yung etiology natin? Sige. Last, nurses, for the etiology, we have your social causation hypothesis. Again, we have, nurses, your social causation hypothesis. Ano naman po yung social causation hypothesis natin, nurses? According now to studies, nurses, people, okay? People who experience, nurses, your economic hardships. Okay? They have higher risk of developing, nurses, your schizophrenia. Ibig po sabihin, yung mga kababayan po natin na medyo hindi po pinalad sa buhay, mas prone po sila magkaroon ng schizophrenia. Bakit? Number one, diet. Dahil hindi po healthy yung kinakain nila, hindi rin po healthy yung mind nila. Another one, recreation. Kung mayaman ka at stress ka, pumunta ka ng Japan, pumunta ka ng Taiwan, okay ka na? Yes or no? Yes. Pero pag medyo hindi ka kayamanan, na-stress ka, anong gagawin mo? Mukmuk sa bahay. Tama po ba? What else, nurses? Is the accessibility of your healthcare. Yes or no? Yes. Siyempre, pag mayaman ka, may pera ka, punta ka sa psychiatrist. Yes or no? Yes. Pero pag hindi ka masyadong mayaman, anong gagawin natin, nurses? Siyempre, hayaan lang natin. Diba? Ipagpasa Diyos na lang natin lahat. Yes or no? Yes. So again, that is your social causation hypothesis po natin. Amen? Okay, may amen. Sino po yung nagsabi ng amen dito? Si Sir Tuazard po. Alright. Sige, nurses, please remember your dopamine and your serotonin. Decrease CSF and less brain tissue for the etiology of your schizophrenia. Okay? Sige po, nurses, clear ko na po ha. Clear na po ni Sir Ken. Let's now proceed to the other important points po in the management of your patient with schizophrenia. Okay? Sige po. Clear ko na ha. Go. Nurses, let's now have the positive or hard signs of your schizophrenia. Okay? Sir, bakit po sinabi dyan positive or hard sign? Okay. Bingo, nurses. If you say positive or hard signs of schizophrenia, nurses, ang patient mo nagkaroon ng ganitong manifestation all because nag-increase po ang inyong dopamine. Again, the cause of your positive or hard signs of your schizophrenia, that is a decrease, nurses, sorry, that is an increase. Pagtaas po ng level ng inyong dopamine. Okay po tayo dyan ha? Go. Sir, ano po ngayon? Yung iba't ibang positive or hard signs of our schizophrenia. Okay po? Sige, check ko lang itong ating Facebook Live. Nakamonitor din po ako sa Facebook Live po natin. Go. Sir, let's start with the disturbances in your perception, and that would be your illusion, and another one is your hallucination. Question, nurses. Sabi sa'yo ng patient mo, nurse, tumingin ka sa bintana, may white lady. Okay, pagtingin mo ngayon sa bintana, walang white lady. Ang nakita mo ay kortina na puti. Nurses, is that illusion, hallucination, or is that delusion? I repeat. Sabi niya, nurse, may white lady. Okay, pagtingin mo hindi naman white lady, kortina lang pala. Is that illusion, hallucination, or your delusion? Ayan, yung mga taga-Zoom po, sumagot na. That is your, very good, that is your illusion. Yes or no? Yes, pati po yung mga viewers po natin from your Facebook Live, sumagot na illusion. Very good, nurses, that is now illusion. Sir, bakit po illusion? Because illusion, nurses, please remember, that is, okay, that is defined as the misinterpretation of your external stimulus. Again, that is the misinterpretation, nurses, of your external stimulus. Again, the word is external. Ang tingin niya sa kortina ay white lady. Ano yung external stimulus mo? That is the kortina. Yes or not? Yes. Sir, ano naman po ang hallucination? Sige, nurses, gamitin po natin ang exact the definition sa book ni Videback 2028 edition. How did he define or how did she define, nurses, your hallucination? That is now your false sensory perception. Again, please remember, that would be your false sensory perception. Nurses, please remember, your keyword here is sensory. Bakit po? We have your senses. Yes or no? Yes. Ano po yung mga senses po natin? Sense of taste, sense of smell, sense of hearing, sense of view, sense of sight. Yes or no? Yes. We have your visual hallucinations. We have your auditory hallucinations. We have your tactile hallucination. What else? We have your olfactory hallucination, and we also have your gustatory hallucination. But nurses, let's focus now on the most common form of your hallucination that is experienced by your patients with schizophrenia, and that is your auditory hallucination. Okay, sabi ng patient mo, nakita mo ngayon yung patient mo, shout out daw po sa mga BSN 401. Okay, sige po, shout out po sa lahat sa inyo. Okay, sige po. Sabi po ng patient ninyo, nurse, or nakita mo yung patient mo ngayon, may kausap siya. Alright. Pero wala naman siyang kausap. Ganito ang itsura ng patient mo. Bingo. Meron ba siyang naririnig? Yes or no? Yes, that is your auditory hallucination. Nurses, pasimplihan natin. Pag ang patient mo, for example, may nakikita na hindi mo nakikita at may naririnig na hindi mo naririnig, nurses, that is your auditory hallucination. And bingo, please remember, nurses, sabi po ni Ma'am Karina Zamora, tama po kami, ma'am, ayan, that is the most dangerous type of your delusion. Again, that is the most dangerous type of your hallucination. Bakit po siya most dangerous type versus of your hallucination? Because the patient might be hearing something, or the patient must be listening to a voice or hearing a voice that is telling him or her to kill someone or to kill him or herself. To commit murder or to commit suicide. Yes or not? Yes. That is why it is considered as the most dangerous form of your hallucination. Sir, paano ngayon yung patient ko, for example, nagkakaroon ng hallucination, tapos tinanong mo si patient mo, alright, sige, nurses, tandaan mo lang po, ang mnemonics na ibibigay po sa inyo ni Sir Ken. Okay? Go. Nurses, ito lang po ang gagawin ninyo. Huwag kayong kabahan. If the Board of Examiner asks you, how are you going to intervene, for example, if your patient is having auditory hallucination, ito lang po ang basehan ng mga sagot natin. Okay po tayo dyan ha? Go. Please remember your heart. Nurses, please remember your heart. Okay, yung mga nag-undergo na po sa akin ng psych lecture, alam na nyo na to, yes or no? Yes, ang bibilis niyong sumagot and I'm so proud of you guys. Bakit po? Memorize na ang concept ng psychiatric nursing, yes or no? Yes po. To those na hindi pa nag-under sa akin ng psych nurses, I'll promise you after ng lecture po natin, master na master po natin ang psych nursing po natin. Yes or no? Yes. Agree po ba sa akin? Yung mga nag-undergo na po ng psych lecture sa akin, yes or no? Yes, I hope naalala pa po lahat ng mga discuss natin. Yes or no? Yes po. Okay? Sige nurses, let us now recall your heart. Go. Sir, ano po yung letter H? Haha, charot lang. Okay, hard nurses, that is your hallucination. Must be recognized. First nurses, hallucination nurses must be recognized. Okay, pag nakita mo si patient mo, may kausap. Yes, oo. Sige, mamaya. Bingo, you recognize the hallucination. Carlo, for example, Carlo yung pangalan ng patient natin. Carlo, are you hearing voices? Or Carlo, it seems that you're listening to something that is already recognition of the hallucination. Yes or no? Yes po. Go. What is letter A nurses? Put a big star. The most important thing, the most important intervention for the nurse to do, that is now to assess the content of your hallucination. Again, that is to assess the content of your hallucination. Bakit po natin i-assess? Sabi po natin kanina, the patient might be hearing voices telling him to commit murder or to commit suicide. Yes or no? Yes. Therefore, sabihin mo sa patient mo, Carlo, are you hearing voices? Sabi ng patient mo, yes, nurse Ken. May mga boses akong naririnig. Anong gagawin mo? You assess the content of the hallucination. Yes or no? Yes. How are you going to assess the content of the hallucination? Carlo, what are the voices telling you? Carlo, ano ang sinasabi sa inyo? Or ano ang sinasabi sa iyo ng mga boses na naririnig mo? Nurse, sabi niya, mamayang gabi, papatayin daw kita. Bingo! Kailangan nga ba ngayon ng safety precaution? Yes or no? Yes. Or pwedeng sabi ng naririnig niya, sabi sa akin, nurse, magpakamatay daw ako, walang nagmamahal sa akin. Bingo! Suicide precaution naman tayo. Yes or no? Yes. Again, you need to assess nurses the content of your hallucination. Okay. So, sir, what is letter R naman po? Sabi niya, sir, papatayin daw niya ako. Sir, alam, nakakatakot naman, sir. Nurse ko, makamachomba ako, makamajombag ako. Okay. Bingo, nurses. What is the next nurses? Letter R, that is now to present nurses the reality. Again, to present nurses your reality. Sir, how am I going to present reality? Carlo, I know those voices are real to you, but I don't hear them. There are only two of us in the room. How about we go to the garden and take a look at the blooming flowers? Bingo, you presented reality nurses and you distracted the client. Again, present and reality and distract the client. Yes or no? Yes. And in a swift and smooth manner. Swift and smooth, i-distract mo kagad-agad. Don't give chance for the client now to rebut. Bakit? Pag nag-rebut siya, mag-aaway kayo. Yes or no? Yes, hindi nurse, narinig talaga ako. Huwag mo siyang bigyan ng pagkakataon na magsalita. I-distract mo kaagad siya. Okay, Carlo? I know those voices are real to you, but I don't hear them. Okay? So, there are only two of us in the room. Okay, and I don't see anything, I don't hear anything. How about if we go to the garden and check on the flowers? Bingo, distract and presenting the reality. Okay, si patient mo ngayon, sige, sama na siya doon. Okay, sige, tingnan natin yung mga flowers. Bingo, nakita ba niya yung flower? Yes or no? Is a flower reality? Yes or no? Yes. Okay, present reality plus distract the patient. Wala akong naririnig na sinasabi mo. Is that clear? Okay, again ha, sir, ano po yung mga role tuloy. Ano po yung mga rule po natin, nurses, okay? These are the rule of the thumb, nurses. Kumukulog po, nakatakot. Okay, these are the rule of the thumb in intervening with your patient with schizophrenia. Sige po, do not. Ilagay mo na po dyan, nurses, do not. 1, do not confront the client. Again, do not confront the client. But you assess, yes or no? Yes, then present reality. Huwag mong sabihin, hindi naman totoo yan. Kung ano yung naririnig mo, hindi totoo yan. Walang ganyan. Okay, that is confronting the client. Yes or no? Yes. Another one, nurses, do not argue with the client. Again, do not confront the client, do not argue with the client. And lastly, okay, do not play along with the client. Again, do not play along with the client. In short, nurses, huwag mong sakyan yung sinasabi niya. Yes or no? Yes. Okay? Again ha, huwag mong sakyan yung sinasabi. Do not confront, do not argue, do not play along. But hey, you are going to recognize, assess, present reality, and distract the client. Yes or no? Yes, nurses. This will now be your management for your patient with auditory hallucination. Hard sign? Yes. Positive sign? Yes. Because of dopamine or serotonin, that is your dopamine. Yes or no? Yes po. Okay? Sige. Sir, okay na po ba tayo? Okay na po tayo dito sa management po natin in your auditory hallucination. Sige po. Clear ko na po ha? Clear ko na? You may take a screenshot of the lecture. I'll be moving on now to the next slide po natin. But anyway, nurses, everyone, ano po ulit or how are we going again to intervene if your patient is having schizophrenia? Ano po yung letter H po natin? Everyone, kindly in. Ano po yung letter H po natin? Sige. That is your hallucination must be recognized. Ano yung pinaka-importante rin sa letter A po natin? Ano po yung letter A naman po natin? That is to, very good everyone from Zoom and from Facebook as well. That is now to assess the content of the hallucination. Yes or no? Yes, for safety precaution. Safety of the nurses and safety of the client himself. Okay? Ayan, very good everyone. And then present reality and distract po tayo. Alright? Sige po. Clear ko na, clear ko na. Okay, go. Sir, ano pa po yung mga positive or hard signs ng ating schizophrenia? Okay, sige. Tandaan mo, nurses, pag hard signs, okay, pag hard or positive signs, more on perception and thought. Okay, mamaya pag-usapan natin yung mga negative naman that is more on your emotions. Go. Sige. Next, nurses, let's have your disturbance in thought naman po. Sa utak lang. Okay, sige. Go. Nurses, how did we define your hallucination? Kanina, we defined your hallucination, nurses, as false sensory perception. Ang patient mo may nakikita na hindi mo nakikita or may naririnig na hindi mo naririnig. Yes or no? Yes. Tandaan mo naman, nurses, pag sinabi ng examiner, delusion, paano mo maalala ang word na delusion? That is, nurses, your false belief. Again, delusion, nurses, that is your false belief. Hallucination, may nakikitang patient mo na hindi mo nakikita. Delusion, may iniisip or may pinapaniwalaan ang patient mo na hindi naman makatotohanan. Yes or no? Yes, that is now your delusion. False belief, maling paniniwala. Yes or no? Yes. Okay, mamaya malalaman natin ano naman ang gagawin mo kung ang patient mo ngayon ay may maling paniniwala. Yes or no? Yes. Nurses, we have different types of your delusion. We have your paranoid or persecutory, or the patient thinks or falsely believe that someone is going to kill or harm him or her. That is now your paranoid or persecutory. The keyword is someone is going to harm or kill the patient. Sir, ano naman po yung grandiose delusion po natin? The patient believes that he or she is a VIP or a very important person. I am Queen Elizabeth, sabi ng patient mo. Is that delusion or hallucination? That is a form, nurses, of your delusion. Bakit? Naniniwala siya na siya ay si Queen Elizabeth. Yes or no? Bingo, that is now your grandiose delusion. Very important person. What else, nurses? Somatic delusion naman po. What is somatic delusion, Mr. Arzadon? Somatic delusion, nurses, that is now a person falsely believes, nurses, that he is ill, sick. That is your somatic delusion. Okay, bingo. Ilagay mo dito, nurses, ang pseudo-sciasis. Ilagay mo dito ang pseudo-sciasis. What is pseudo-sciasis, nurses? That is false pregnancy. Again, this is your false pregnancy. Sir, di ba sa OB yan? Yes po. But if you're going to check the book of Videback, nurses, nilagay na po na dyan ang pseudo-sciasis or your false pregnancy as a form of your somatic delusion po. Ibig sabihin, yung lalaki naniniwala na siya ay buntis. Yes or no? Yes po. Sir, ano naman po yung nihilistic delusion? Bingo, false belief, nurses, that a body part is missing. Again, nihilistic delusion, a false belief that a body part is missing. Nurses, nawawala. Nurse, tulungan mo ako. Nawawala yung mga intestines ko. Kinuha ng mga alien. Okay. Oh my God. That is your nihilistic delusion. Yes or no? Nawawala daw yung stomach. Ano nawawala daw yung stomach? Nawawala daw yung kanyang, ano ba? Yung kanyang mga intestines. That is your nihilistic delusion. Annihilation, ibig sabihin, may tinanggal or may nawala. Okay? Sige po. Kinakabahan po ako. Medyo kumukulog po ngayon dito sa Mandaluyong. Hindi ko pa alam ba't kumukulog. Dahil siguro sigaw ako ng sigaw or nagde-delusion ako. Alright? Sige, go po. That is now the different types of your delusion, nurses. Yes or not? Yes po. But hey, nurses, let us focus now on your paranoid and persecutory delusion. Again, let us now give focus to your paranoid and persecutory delusion. Okay, clear ko na ha? Clear ko na po? Tumitik a screenshot. Ililipat ko na po in 5, 4, 3, 2, and 1. Go. Sir, ano ulit yun? Paranoid. Persecutory. Feeling mo or feeling ng patient mo merong mananakit or merong papatay sa kanya. Yes or no? Yes. Again, that is your false belief. Sir, pag ang patient ko, sabi mo kanina, merong hallucination, ang gagawin namin ay hard. Yes or no? Yes. What is hard? Hallucination must be recognized, assess, reality, and divert. Yes or no? Yes. Sir, paano naman po pag ang patient ko may delusion? Okay. Same nurses rule of the thumb po natin. Never ever or do not confront, do not argue, do not play along with the client. Yes or no? Yes. Well, however, nurses, please remember, idagdag mo po dito, do not reinforce the delusion. Again, do not reinforce the delusion. Huwag mong sakyan or huwag mong hayaan yung patient mo mag-concentrate ngayon dun sa iniisip niya. Yes or no? Yes. Sir, paano ko ngayon gagawin yan? Okay. Please remember, nurses, we also have what we call your card naman po dito. Okay, go. If I say card, nurses, okay, ang lakas po ng ulan. Umuulan po dito sa Manila. Okay? Umuulan din po ba dyan sa inyo? Ayan, sige po. Nurses, what is letter C? Bingo, put a big star, nurses. According to Beck, anong sabi niya? The first or the initial approach in dealing with your delusion, that is to clarify the delusion. Again, to clarify the delusion. Kailangan mong malaman, nurses, bakit ganon ang iniisip ng patient mo. Yes or no? Yes, sir. Example po, how will I clarify the delusion of my patient? Bingo, sabi ng patient mo sa'yo, nurse, please, nurse, wag mong hayaan silang saktan ako, sabi ng patient mo. Nurse, please, wag mo silang hayaan saktan ako. Sasaktan nila ako. Nagde-delusion na ang patient mo. Yes or no? Yes, paranoid or persecutory delusion. How are you going to clarify now the delusion of the patient? Tanungin mo siya, Carlo, who do you think is planning to hurt you? Or who do you think is going to harm you? That is already clarification of the delusion. Yes or no? Yes. Bakit kailangan mong malaman? Kailangan mong malaman dahil baka may relasyon yan dun sa condition ng patient mo. Yes or no? Yes po. Sir, paano pag sinabi nga, clarify ko na? Okay, sabi niya ngayon, nurse, yung janitor, sasaktan ako nung janitor. Bingo. What is letter A naman, nurses? That is now to acknowledge the word here, nurses, the feelings. Acknowledge the feelings, but not the delusion. I repeat, nurses, acknowledge the feelings, but not the delusion. Sir, what do you mean by acknowledging the feelings, Carlo? I can see that you are afraid, but I don't think, or I can't think of any reason for someone to hurt you. Is that clear? Acknowledging the feelings. Carlo, nakikita ko na natatakot ka. I can see that you are afraid. That is now acknowledging the feelings. But again, letter R, that is now presenting, nurses, reality. But I can't see, or I don't see any reason for anyone in this building to hurt you. That is now presenting the reality after acknowledging the patient's feelings. Yes or no? Yes. And the next, nurses, letter D, that is also now to distract the client. Yes or no? Again, yung ating favorite na line, how about we go to the garden and take a look at the flowers? Yes or no? That is now how you are going to distract now your patient with delusion. Yes or no? Yes. Kanina, hallucination, you are going to assess. Yes or no? Yes. Kasi kailangan mong malaman kung anong sinasabi ng mga bosses. Pero pag delusion naman, you need to clarify. Bakit? Kailangan mong malaman kung ano yung pinanggagalingan ng patient mo. However, nurses, again, you acknowledge and present reality. I can see that you're afraid, but I can see any reason for anyone to hurt you. Nurses, question. Ito ngayon ang tanong dyan. Maniniwala ba sa'yo ang patient mo, for example, na walang mananakit sa kanya? Yes or no? Yes. Again, the question, will the patient, for example, once you voice doubt, will the patient now believe you that no one is going to hurt him or her? Yes or no? Question, will the patient believe you? If you are going to tell the patient, hey, no one is going to hurt you. Ano pong sagot po natin, nurses? Is that a yes or a no? Okay, no, I think, sabi ni Sir Nico. Maybe no initially, okay? How about sa mga friends po natin sa Facebook Live po natin? Is it a yes or a no? Sabi po dito sa, saan po? Sa, ang tawag dito, Zoom. Karamihan no. No din. Sabi nila sa Facebook Live. Bingo, nurses. If asked in the board examination, nurses, what is the most important, okay, thing to establish before any nurse-patient relationship? That is your, put a big star, nurses, that is your trust. Bingo. At the first phase pa lang ng inyong nurse-patient relationship, you should have established, nurses, trust with your patient. Yes or no? Yes. Bakit kailangan ng trust, sir? Para pag nag-voice ka ng doubt, for example, Carlo, I can see anything or I can see any reason for you or for someone to hurt you. Maniniwala ba siya sa'yo? Yes or no? Yes. Maniniwala siya dahil meron siyang tiwala, meron siyang trust at nakapag-build ka ng rapport. Yes or no? Yes. Put a big star, nurses. That is the importance of your trust. Kailangan sa unang-unang araw pa lang, nurses, may tiwala na sa'yo ang patient mo. So that the moment that you are going to voice doubt or the delusion, parang hindi naman ganoon yung nakikita ko. Parang wala akong nakikitang mananakit sa iyo. Bingo, magtitiwala sa iyo ang patient mo. Yes or no? Yes, dahil meron kang trust. Sir, how will I build trust? Simple lang. Paano ka mag-build ng trust? Contract. Yes or no? Yes. Yung contract natin, pag-uusapan natin on the actual review. Yes or no? Yes po. Okay? Sige, go. Okay, nagsilabasan na po yung mga hugot natin. Anong sabi po ng mga girls? Minsan, sinisira daw ang tiwala. Yes or no? Yes. Tama po yan? Okay, again ha. Wag na wag niyong sisirain ang tiwala ng isang tao. Yes or no? Yes. Dahil pag nasira yan, hindi na yan may babalik. Tama po ba? Boys? Girls? Nasira na bang tiwala ninyo? Alright, sige po. Bigyan mo ng milk tea, sabi ni Ma'am Jing Tiana. Okay, 100%, sabi ng Kimberly. Hugot, sabi ni Atherton. Again, wag na wag mong sirain ang tiwala. That is the importance, nurses, of your trust para paniwalaan ka ng patient mo na walang mananakit sa kanya. Yes or no? Yes. Pero minsan, sinasabi ng mga boys, hindi kita sasaktan. Pero sa bandang huli, naiwan ka, umiyak ka, ng walang dahilan. Yes or no? Yes. In short, iniwan ka ng walang dahilan. Tama po ba? At ang hirap mag-move on, nurses, pag hindi mo alam yung dahilan. Yes or no? Yes. Anong sabi natin? Kung iiwan mo ako, sabihin mo ang dahilan kung bakit mo ako iiwan. Yes or no? Yes. Dahil kung alam mo ang dahilan kung bakit ka iniwan, meron kang dahilan para mag-move on. Tama po ba? Pero pag iniwan ka ng walang dahilan, nurses, wala ka ring dahilan para mag-move on. Tama po ba? That is why, boys, especially boys, kung mangiiwan kayo ng babae, sabihin nyo ang dahilan, bakit nyo sila iiwanan? Para may dahilan sila para mag-move on sa buhay. Yes or no? Yes. Tama po ba? Sir, bakit tayo napunta doon? Ewan ko sa inyo. Humugot-hugot kasi kayo. Alright, sige po. Ayan. Okay. Miss Veronica is shaking, sabi ni Sir Roseller. Okay, sige pa. Let's go now. Let's proceed now. Go. Kaya may importante po ang tiwala. Go. Faithful daw po si Sir Nestor. Okay? Ayan po. Go na. Pighati. Sabi ni Mark Jerome. Guys, ang lakas ng ulan. Nakakatakot. Go. We also have nurses, your referential delusion. Sir, ano naman po yung referential delusion po natin? Please remember, nurses, your referential delusion naman po, okay? That is now giving meaning. Again, nurses, this is giving meaning to the action of others. Again, this is giving meaning to the action of others. Yung patient, for example, nakita niyo yung mga nurses nagsasalita. Sabi ng nurse, hoy, pinag-uusapan niyo ako dyan, no? That is already your referential delusion. Yes or no? Yes po, nurses. These are now the disturbances in your thought po. Okay? Sige po. Clear ko na ha? Clear ko na po in 5, 4, 3, 2, and 1. Sige po, nurse, screenshot mo na para milipat na po natin sa next topic po natin. Okay? Sige. Ayan, nurses, hopefully, hindi ako mawalan ng internet kasi sobrang lakas ng ulan ngayon dito sa amin. Alright? Sige po. Ayan, saga. Let's pray na hindi ako mawalan ng internet dito para gumabagyo siya. Okay, go. Let's have versus other disturbances in your thought naman po. Okay? Let's have other disturbances in your thought. Tiwala lang, sir. Okay. Ano yung big word natin ngayon? Trust. Yes or no? Yes, tiwala. Okay? Go. There says we also have other disturbances pa po in your thought. We also have there's what we call your circumstantiality. Sir, ano po your circumstantiality po natin and your tangential thinking? Please remember, nurses, both circumstantiality and tangential thinking, this is providing too much details. Again, both of them, nurses, are providing too much details. Ano lang pagkakaiba po nila? Circumstantiality, nurses, for example, may tinanong ka sa patient mo. You ask for something, sinagot niya sa yung sagot niya ay paikot-ikot. Yes or not? Yes, bingo. Pag sinulat mo ang circle or pag nag-drawing ka ng circle, paikot, pero bumabalik ka kung saan ka nag-start. Yes or no? Yes. Circumstantiality, that is now providing too much details. However, the patient returns to the original topic. Again, nurses, circumstantiality, the patient provides too much details but returns to the original topic or answers the question of the nurse. Circumstantiality, umiikot siya pero bumabalik siya. Yes or no? Yes po. Sir, ano naman po yung tangential thinking? Ito po yung masakit. Yung pinaikot-ikot ka niya pero hindi ka naman niya sinagot. Yes or no? Yes. Pinaikot-ikot ka lang niya pero iba yung sinagot niya. Yes or no? Yes. Tangential thinking, providing too much details but the patient does not return to original topic. Ayan. So, pinaikot-ikot ka, hindi ka naman sinagot. Yes or no? Yes. Mas masakit yon. In short, nurses, paasa. Yes or no? Yes. Nakailang libre ka sa kanya ng isaw, pero hindi kanya sinagot. Yes or no? Yes. Isaw lang palang habol niya sa'yo. Palibre ng isaw, palibre ng barbecue, palibre ng milk tea. Yes or no? Yes. But in the end, nurses, hindi kanya sinagot. Tama po ba? That is your tangential thinking. Providing too much details. However, the patient doesn't go back to the original topic or doesn't answer your question. Okay ba tayo dyan, ha? Sige po. Nurses, we also have your associative looseness and we also have your flight of ideas. Okay. Bakit ang dami pong nasasaktan yata? Okay. Pasensya na po, parang ang daming lumuluha ngayong gabing to. Yes or no? Yes. Throwback Thursday po ba tayo ngayon? Ayan, Saturday na po tayo. Tama na, sabi ni Ma'am Flora May Ortiz. Hindi. Hindi. I am presenting reality. Yes or not? Yes. Kailangan nyong malaman ang reality na ang pagmamahal kailanman ay hindi madali. Yes or no? And that is reality. How about we go to the garden and take a look at the flowers? Yes or no? Yes po. Sige. Charot lang. Okay. Let's go na po. We do your associative listness and your flight of ideas. Magpayaman na lang daw po si Ma'am Rodalyn. Okay? Sige, nurses, let's go. May pag-atake na naman, sabi nung isa. Let's go to the garden. Okay, nurses? If you're sad, let's go to the garden. Charot. Divert na, sir. Okay. Sige. Nurses, we also have your associative looseness and your flight of ideas. Again, nurses, we also have your associative looseness and your flight of ideas. Nurses, I will be using now the new definition on the book of Videback, yung 8th edition po natin. Sir, paano po dinefine sa bagong book ni Videback ang associative looseness? Sige po. That is poorly related thought. Again, associative looseness nurses, that is poorly related thought. The word here, nurses, please remember, thought po. Ibig sabihin, it all happens in the mind of the patient. Yes or no? Yes. But if you say flight of ideas, nurses, flight of ideas, that is already, please remember this one, that is already the rapid speech. Okay? Composed of fragmented ideas. This is the updated definition, nurses, of your associative looseness and flight of the ideas based on the 2020 edition of your BDBAC Psychiatric Nursing book. Sir, tandaan mo lang, pag associative looseness, it is more on your thought. Yes or not? Yes. Pero pag flight of ideas, nurses, tandaan mo lang, yung isip niya, pinalipad na niya. Yes or no? Yes. Pinalipad na niya papunta sa'yo. Bakit? Sinasabi niya na sa'yo. This is already verbalization. Yes or no? Yes. Pinalipad na niya papunta sa'yo. However, there is fragmented ideas, nurses. That is your flight of ideas. Sir, ano naman po yung latency of response po natin? Latency of response, nurses, the patient now will respond only after 30 to 45 seconds. Ayan. So yung mga boyfriend ninyo, for example, ang tagal-tagal mag-reply sa inyo, yes or no? Yes. Pero nakita mo, naka-online naman, yes or no? Yes. Pero hindi sinisin yung chat mo, yes or no? Yes. Oh my God, latency of response. Respond only after 30 to 45 seconds. Okay lang sana kung 30 to 45 seconds. Pero yung boyfriend mo will respond after 24 hours. Yes or no? Pasensya na babe, nakalimutan ko yung cellphone ko. Yes or no? Yes po. Again, latency of response, respond only after 30 to 45 seconds. Nurses, these are the other disturbances in the thought of a patient now with schizophrenia. Okay po tayo dyan, ha? Go. Recall, sabi natin, pag circumstantiality, umiikot-ikot pero bumabalik sa normal, sa original topic. Yes or no? Yes. Pag associative looseness, more on poorly related thoughts. Pero pag pinalipad na niyo yung thoughts na pinalipad niya papunta dun sa nurse, dinerbalize niya na. That is already your flight of ideas. There is rapid speech now, composed, nurses, of your fragmented ideas. Nurses, are we still under the positive signs of your schizophrenia? Yes or no? Yes po. Again, we are still under the positive signs of your schizophrenia. Ang sakit-sakit ng, para ang sakit-sakit ng lecture natin ngayon. Ganun po talaga. Presenting reality. Yes or no? Yes po. Go. Diretso tayo, nurses, ha? I-clear ko na po. In 5, 4, 3, 2, and 1. Let's proceed now to the next topic. Take a screenshot. Go. Sige. Nurses, we also have naman the negative or soft signs of your schizophrenia. Again, we also have the negative and soft signs of your schizophrenia. Okay. Sir, bakit negative of soft signs? Kanina, nurses, sabi ko, pag positive signs, that is because of dopamine increase. Yes or no? Yes. Pero, pag negative sign, nurses, this is more on the increased, nurses, of your serotonin level. Okay. Pag nag-decrease ang serotonin level, nurses, nagkakaroon tayo ng depression. Pero pag sobra-sobra naman ang serotonin, nurses, nagkakaroon din tayo ng negative signs ng inyong schizophrenia. Go po. Sir, ano ngayon po yung mga negative signs po ng aming schizophrenia? Go. One, nurses, we have your asociality. Pag sinabi mong negative, nurses, tandaan mo lang ang word. The keyword here, nurses, sige, sulat ko sa likod, ha, that is your lack of. Again, the word here is lack of. Kulang or wala. Lack of. Okay. What is anhedonia, nurses? That is lack of what? Anhedonia? That is lack. Or sorry, asociality muna tayo. What is asociality? That is lack, nurses, of social relationship. Again, that is lack of your social relationship. That is your asociality. What is volition naman, nurses? That is lack of motivation. Lack of motivation to accomplish task. Again, lack of motivation to accomplish your task. And last, nurses, is your anhedonia. What is anhedonia naman po, Sir Ken? Anhedonia, very good everyone. Sa mga sumasagot po, maraming salamat, very good po. That is your lack of your, pleasure. Yes or no? Again, lack of your pleasure. Bingo, nurses. If asked now in the board examination, what are the initial signs of your schizophrenia? Ito po ang hahanapin natin. Again, if asked in the board exam, put a big star. What are the earliest sign, nurses, of your schizophrenia? Hindi po sasabihin ni board examiner asociality evolution anhedonia. Ano pong sasabihin niyo dito? That is loss of interest in school or work plus neglect of your hygiene. Bingo. Again, what is considered now as the earliest sign of schizophrenia based on the book of feedback? That is now the loss of interest in school at work plus a neglect of hygiene. Pasok na po ba siya dito? Yes or no? Yes. Abolition. Lack of motivation to accomplish tasks. Ayaw nilang pumasok? Lack of social relationship and your lack of pleasure. Yes or no? Yes po. Sir, ano pa po yung ibang signs po namin ng negative signs of your schizophrenia? Nurses, we also have, please remember, your alogia. For alogia, nurses, please remember, we also have two here under your alogia. We have what we call, nurses, your poverty of speech. And we also have what we call your poverty of content. Again, nurses, under alogia, that is the poverty of speech and the poverty of content. Sir, ano po yung poverty of speech? That is lack of words. The patient, nurses, speaks a little. Again, the patient speaks a little. Sir, ano naman po yung poverty of content? That is, nurses, lack of substance. I repeat, that is lack of substance. Ibig sabihin, in short, nurses, nonsense yung sinasabi ng patient mo. Yes or no? Yes. Bingo. Poverty of speech and your poverty of content. Another letter A, nurses, that is now your affect. And we have different types of your affect, nurses. Please remember, we have what we call your flat affect. We also have what we call your blunt affect. And we also have what we call, nurses, your inappropriate affect. Again, please remember, under your affect, negative sign of schizophrenia, that would be your flat, blunt, and inappropriate affect po natin. Sir, ano po yung pagkakaiba ng mga yan? If you say flat affect, nurses, there is no facial reaction or expression. Again, pag affect, nurses, this is what? This is an expression of your mood. Yes or no? Yes. Again, affect is an expression of your mood. More on external. Yes or no? Yes. Pag sinabi mo naman na blunt affect, nurses, please remember your blunt affect, that is now your minimal facial expression. Sabi ng patient mo sa'yo, that is your blunt affect, minimal facial expression. Yes or not? Yes. How about inappropriate affect, nurses? If the expression, again, inappropriate affect, if the expression, nurses, is incongruent, the word, nurses, is incongruent with the context of the situation. Again, if the expression is incongruent with the context of the event or situation, that is your inappropriate affect. Ibig sabihin, nurses, yung patient mo, nagkikwento ng isang malungkot na bagay pero nakangiti. Yes or no? Yes. Alam mo, nurse? Alam mo, nurse, nung bata ako, nawala yung nanay ko, iniwan ako ng nanay ko, kaya lang mag-isa. That is your inappropriate affect. Malungkot yung kwento, pero tumatawa siya. Pwede ring malungkot or pwede ring masaya yung kwento, pero malungkot yung mukha niya. Yes or no? Yes, that is now your affect. Sir, what is most common po to your patient with schizophrenia? Please remember, that would be your inappropriate affect. Bakit again? There are splitting or there is a splitting of your soul or splitting of your mind. Yes or not? Yes. That is why nurses, if you're asked now, what is the most common type of affect? If your patient now have schizophrenia, that is your inappropriate affect. Sir, ano naman po yung katotoo niya? Ba't ang dami na namang hugot sa ating Facebook Live? Tinatago ang sakit, yes or no? Yes. Tumatawa-tawa ka lang. Pero deep inside, ang sakit-sakit na. Yes or no? Yes. Inappropriate affect. Nagdurugo ang puso mo. Pero nagniningning ang mga ngiti mo. That is your inappropriate affect. Yes or no? Yes. Ang tamis-tamis ng ngiti mo, pero ang pait-pait ng pinagdadaanan mo. Yes or no? Yes po. Bakit mapait? Dahil ikaw ay pinagpalit. Yes or no? Yes po. Pasensya na po sa mga nasasaktan. Okay? Sige. Diretso na po tayo, nurses. Go. Sir, ano naman po yung catatonia po natin? Okay po. Sige po. Okay, very good po. Catatonia, nurses, that is your induced immobility. Catatonia, that is your induced immobility plus your waxy flexibility po. Again, that is your waxy flexibility. Sir, ano po yung waxy flexibility? If you are going to raise the hand of your patient, nurses, nakataas lang yan. Hindi niya yan ibababa. Yes or no? Yes, that is your waxy flexibility. Robot-like po. Okay? Plus, nurses, there is also mutism. Dagdag mo na po dyan, there would be mutism. What is mutism po? Yung patient mo ay hindi nagsasalita. Yes or no? Yes, that is your mutism. Nurses, these are all the negative signs of your schizophrenia. What is affected? That is your serotonin. Kanina, ano po yung mga positive signs po natin? Positive signs, more on thought. Yes or no? More on perception. Hallucination, illusion, delusion, circumstantiality, flight of ideas, lahat po yun ay positive signs. Positive signs, more on the thought of the patient, more on the perception of the patient. Pero pag negative signs, nurses, more on the what po? More on emotions po natin. Yes or not? Yes, because of your serotonin. Okay? Sige po. Nurses, can I transfer na? Okay po, screenshot nyo na po. Lilipat ko na po in 5, 4, 3, 2, and 1. Go. Pas ng ulan, ha? Nurses, we have other signs. We also have nurses, your neologism. Nurse, tulungan mo ako. Parating na yung mga chururot, sabi ng patient mo. What is chururot? Okay, that is your neologism. Yes or no? Yes, that is your coining of new words. Again, neologism, that is coining of new words. Ang patient mo may mga sinasabing salita na hindi mo maintindihan. That is your neologism. Sir, ano naman po ang aming schizophasia? Schizophasia says, this is your word salad. There is no rhyme. Again, there is no rhyme. Pinaghahalo-halo lang niya yung mga salita. Apple, orange, mommy, infant. Halo-halo pero walang rhyme. But if there is rhyme, nurses, that is already your clang association. Again, clang association, that is now mixing of words with rhyme. Sabi sa'yo ng patient mo, my name is Jill and I want to go up the hill. I will not take my pill and I want to kill. Oh my God, that is your clang association. Yes or no? Mixing of words with rhyme. Okay pa. We also have nurses, what we call your echolalia. Sir, ano naman po yung echolalia? Echolalia, nurses, please remember, this is repeating the words of others. Again, echolalia, that is repeating, nurses, the words of others. Pero verb vigiration naman, nurses, that is also repeating. However, that would be the patient's own words po natin. Nurses, para madaling tandaan, pag echo, ibig sabihin umuulit. Hello, 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 hello. Yes or no? Yes. Isang beses mo lang sinabi, pero may narinig kang sumagot ulit na iba. That is your echo. Yes or no? Yes. Echolalia, that is repeating the words of others. Nag-echo siya. Ini-echo niya yung sinasabi ng nurse. Yes or no? Yes. Pero pag verb vigiration, nurses, that is repeating the own words of the patient. Sabi ng patient mo or sabi mo sa patient mo, Carlo, kumusta ka ngayon? Sabi ni Carlo, ngayon? 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 Is that echolalia or verb vigiration, nurses? The correct answer, that is your verb vigiration. Yes or no? Yes po. Sir, ano naman po yung stilted language? Stilted language, nurses, please remember, this is your flowery words. Mabulaklak magsalita. Yes or no? Yes, that is your stilted language. Ang patient mo ngayon ay mabulaklak magsalita. Okay? Sabi ng patient mo, nurse, excuse me, being the representative of Florence Nightingale, would you do me the honor of providing me refreshment in a form of clear, crystal clear, refreshing water from the ocean? Oh my God, humingi lang ng tubig, ang daming sinabi. Yes or not? Yes, that is your flowery words. Mabulaklak magsalita. Yung mga nanliligaw sa inyo, mabulaklak magsalita. Yes or no? May schizophrenia. That is your stilted language. Yes or no? Yes pa. Okay? Sir, ano naman po ngayon? Yung perseveration. Perseveration, nurses, that is now sticking, or that is now the patient now, nurses, is adhering to a single topic. Perseveration, that is adherence, nurses, to a single topic. Bingo, that is your perseveration po. Nurses, tandaan nyo, echolalia, inuulit niya sinasabi ng iba. Okay? Go. Sige po, nurses, screenshot nyo na po. Screenshot nyo na po. Lilipat na po natin in 5, 4, 3, 2, and 1. Nurses, are you learning? Okay po? Ayan. Yung mga hindi po nag-under sa akin, meron po ba kayo nakukuha information? I hope so. And I hope, nurses, pagdating ng board examination, magsilabasan lahat ng to. Yes or no? Yes po. Alright? Sige po. Very good. Okay? Go. Clear ko na ha? Okay, clear ko na po in 5, 4, 3, 2, and 1. Nurses, let's have some questions. Board exam questions, let's have some. Sample question. A client with schizophrenia says to the nurse, will you protect me from those aliens flying around? Which of the following is the most therapeutic response by the nurse? A, can you describe to me how they look? Let me know if they tell you something. B, you've been here in the hospital for quite some time. It has always been safe. Or C, I can see no Asian alien. You will be safe here. Or D, the Security Management Office maintains the safety of the premises 24/7. Nurses, ano po ang sagot po natin? A, B, C, or letter D? Ayan. Sa Zoom po, ayan, nagsipasok na po yung mga sagot ng mga viewers po natin sa Zoom. How about po sa ating FB Live? Ano pong sagot natin? Okay. So meron C, merong A, meron C, meron A. Yes or no? Sige po. Nurses, let's try to answer this one. Nurses? Ano po ang meron sa patient mo? Will you protect me from those aliens flying? Yes or no? Yes po. What is the best answer? Eliminate mo na to ang letter D. Yes or no? Yes po. Karamihan ng sagot, merong na sumagot ng letter A at merong sumagot ng letter C. Yes or no? Yes. Anong sabi natin, nurses? Do not reinforce or do not play along with the hallucination. Yes or no? Yes. Huwag mong sakyan. Anong sabi ng patient mo sa letter A? Can you describe to me how they look? Nurses, again ha, this is hallucination. not delusion. Yes or no? Yes po. Describing to them how the look or nakita niya, for example, yung alien, that is already reinforcing the hallucination. Yes or no? Ibig sabihin, nakikita mo ba yung mga alien? Oh, ano ang itsura ng mga alien? Ang patient mo ngayon, titingin sa mga alien, titignan niyo yung itsura na. Yes or no? Ano ang itsura ng mga alien? Yes or no? Kaya mali po ang letter A. Yes or no? Yes, dahil you are going to reinforce the hallucination of the client. Oo nga, no? Ano bang itsura ng mga alien na nakikita ko? Titignan niyo ulit yung alien. Bingo, lalo siyang nag-hallucinate. Yes or no? Yes po. Therefore, the correct answer, nurses, that would be your letter A, presenting reality. Yes or no? Yes. I can see no alien. You will be safe here. Yes or no? Yes. It is now presenting the reality. Yes or no? Yes po. Okay? Sige po. Clear ko na. Clear ko na. In 5, 4, 3, 2, and 1. Nurses, please be cautious in using your heart. Okay? Baka kasi walang hallucination must be recognized or assessed, baka magdumiretso sa reality, pwede rin naman po yun. Okay po tayo ha? But again, do not reinforce the delusion of the client. Okay? Clear ko na po, clear ko na po. In 5, 4, 3, 2, and 1. Go! A client tells the nurses that people from Mars are going to invade the Earth. Which response by the nurse would be most therapeutic? Ano naman to? Illusion or delusion or hallucination, nurses? Sabi niya, ang mga tao mula sa Mars ay pupunta sa Earth. Question, is it hallucination, delusion, or illusion? Okay, very good, nurses. That is your delusion. Yes or no? Yes. Again, nurses, this is your delusion. Does it happen only in the mind of the patient? Yes or no? Yes po. Ano pong sagot nyo ngayon? Letter A, that must be frightening to you. Can you tell me more how you feel? B, there are no people living on Mars. C, what do you mean when you say they're going to invade the Earth? Or D, I know you believe the Earth is going to be invaded, but I don't believe that. Nurses, anong sabi ni Kuya Ken kanina? Do you need nurses to clarify the delusion? Yes or no? Yes. Saan po dyan ang clarification of the delusion? The correct answer, nurses. Okay, check ko lang sa Zoom. Letter C. Okay? May sumagot ng A, may sumagot ng letter C, may sumagot ng letter D. Yes or no? Yes po. Sige. Nurses, anong unang sabi ko sa inyo? Anong pinakauna mong gagawin? That is to clarify the delusion. Yes or no? Yes. Saan po dyan ngayon ang clarification of the delusion? The best answer, nurses. Again, what would be the best answer? Okay. Correct answer, nurses, is sa mga sumagot po ng letter A, that is wrong. Okay po. Bakit po? That must be frightening to you. Tama sana siya. Acknowledgement. Yes or no? Yes. Pero anong sabi mo sa kanya? Can you tell me more how you feel about it? Yes or no? Yes. Anong sabi ko kanina? You only acknowledge the feeling. How are you going to acknowledge the feeling? That is telling the patient, I can see that you are afraid. Yes or no? Yes. But you don't need to ask the patient again how the patient feels. Yes or no? Yes, because that is reinforcing now the delusion. Yes or no? Yes. What else, nurses? How about letter D? Sino sumagot? That is also wrong. Yes or no? I know you believe the Earth is going to be invaded, but I don't believe that. Yes or no? Yes, tama sana. Pero again, meron pang best answer dyan. Ano ang uunahin mo? The correct answer, nurses, again, uunahin mo to clarify the content of the delusion. Yes or no? Yes. The correct answer, nurses, that would be your letter C. Unahin mo muna ang clarification of the content of the delusion by asking the patient, what do you mean when you say they're going to invade the Earth? Pag sumagot si patient mo, pupunta sila dito, kakainin nila sa yung lahat, ikukulong nila tayo, gagawin nila tayong mga alila. That is the time, nurses, that you are now going to acknowledge the patient of the patient or acknowledge the feelings of the patient. That must be frightening with you, but I can see no evidence of that. Bingo, that is already voicing doubt to the patient. Yes or no? Yes. I can see that you're afraid, but I can see any evidence of people from Mars coming to the Earth. That is now presenting reality, voicing doubt, then distract the patient. Yes or no? Yes. Nurses, Tandaan mo yung pagkakasunod-sunod. Yes or no? Yes. You clarify first. After you clarify, you acknowledge, present reality, and you are going to direct. Yes or no? Yes po. Is that clear? Okay, nurses, alam ko medyo mahirap. One of the most difficult na questions sa board examination is your therapeutic communication. Yes or no? Yes po. Bakit? Halos lahat ay pare-pareho. Yes or no? Parang lahat naman tama. Yes or no? Yes. However, sabi natin, you need to follow a certain step. Yes or no? Yes. This is why we have discussed it now na po. Sige po, again, this is your therapeutic communication. Okay, di ba? Medyo siya nakakalito. But if you are going to practice and practice nurses, alam na po yan ng mga nag-under sa akin ng psychiatric nursing. Nung nag-lecture po kami nurses, binugbog ko sila ng madaming therapeutic communication. Yes or no? Yes. Nung mga first questions therapeutic communication, hindi nila masagot-sagot. Pero on the later end or later part ng exam nurses, lahat ng therapeutic communication, isang basa mo pa lang, alam mo na ang sagot. Yes or no? Yes po. Alam po yan naman nag-under na sa akin. Yes or no, guys? Diba? Nabugbog kayo ng therapeutic communication. Tama po ba? Okay po. Sige po. Clear ko na ha. Clear ko na po in 5, 4, 3, 2, and 1. Go? Okay. Sige po. Nurses, another one. Go. A client was released from wrist and ankle restraint. Suddenly, the client begins to yell, "Nurse, may tikbalang sa iyong likuran. Takbo!" Okay. The best initial response by the nurse would be, A. Sinasabi mo ba na mukha akong tikbalang? B. Hindi totoo ang tikbalang. C. Wala akong nakikitang tikbalang. Or D. Nakikita ko nag-aalala ka. Dalawa lang tayo ang nandito. Wala akong ibang nakikita. Nurses, what would now be the correct answer? O, di ba? Ang bilis. Kuhang-kuha na agad ang sagot. Yes or no? Yes. The correct answer. Di ba? Nakuha nyo na agad? Bingo, pabugbog ako, sir, sabi nung isa. Sino yun? Sir Sander, bakit gusto mong mapabugbog? Okay? The correct answer, nurses, that would be your letter D. Yes or not? Yes. Nakikita ko na nag-aalala ka, dalawa lang tayong nandito. Wala akong ibang nakikita. Sir, may Tagalog po ba na therapeutic communication sa exam? Opo. Sometimes nabibigay po sila ng therapeutic communication. Okay? Sige po. Nurses, clear ko na ha? Okay. Sige, nurses, hinga muna. Inhale, exhale, inhale, exhale. Alright, sige. Stop share ko lang nurses, huwag kayong umalis. Wait lang po. Stop share ko lang. Punta lang ako sa slide ko. Oh my God. Oh my God. Sino yan? Uy, guwapo oh. Guwapo ba? Asan ba yung slide ko? Wait lang. More questions daw po. Opo, ayan. More questions tayo. Ayan, sige po. Go. Go. Ay, wala. Sige po. Saan na ba yun? Ay, nawala. Nurses, are you learning? I hope so. Okay? Sige po. Sir, mukhang tikbalan. Sana di ako magmukhang tikbalan sa therapeutic communication, sabi ni ma'am. Atherton, Sir Atherton. Okay? Sige po, go. Nurses, let's have now the psychopharmacology. Okay? This is one of the most important nurses na topics po natin ngayon sa inyong lecture. Okay? Sige po. Nurses, let's have your therapeutic psychopharmacology. Oh. So you have 30 minutes recess, tapos natin to. Okay? Alright. Ano yung mga sinasabi ninyo dito? Bakit niyo ako binabash? Hindi ba binabash ako? Huwag kayong mambash. Bakit niyo ako binabash? Charot lang. Okay, I love you guys. I love you everyone. Sige po. Go na. Nurses, let's have your psychopharmacology. Okay? Sige po. Wait lang. Hinga lang ako Inom lang ako. Go. Bingo. Let's have now the medications that are being used now in the management of your patients, nurses, with your schizophrenia po. Nurses, I want you to know, nurses, that your antipsychotic drug or your neuroleptic medication are divided into 2, actually 3 na siya ngayon. Meron na pong 3rd generation antipsychotic medication po natin. Go po. Nurses, I want you to remember, we have first generation and your second generation antipsychotic medications. Sir, ano po ang pinagkaiba ngayon ni first generation at ni second generation antipsychotic medication po? Bingo! Please remember, pag sinabi mo nurses na first generation antipsychotic medication, these medications, nurses, are dopamine antagonist. Again, nurses, this is your dopamine antagonist. It decreases the level of your dopamine. Pero pag sinabi mo naman, nurses, na second generation, atypical medication, this decreases, nurses, both dopamine and serotonin. Antagonist po siya. So both dopamine at serotonin, pinapababa po niya. Yes or no? Yes. That is why, nurses, ano po ang focus ng first generation antipsychotic medication ninyo that is now to decrease your positive symptoms. Why? Sabi ko kanina, pag positive, the cause is your dopamine. Yes or no? Yes po. Pero, pag second generation, nurses, this is now given to elevate nurses symptoms, which is now your negative symptoms. Ano po ulit yung mga negative symptoms po natin? More on your emotions. Yes or no? Yes, mga negative, mga anhedonia, abolition, ano pa, yung mga lohia, okay, your affect disturbances, lahat po yun, those are all more in emotions, negative symptoms po natin. Sir, paano po namin malalaman ngayon kung ang gamot ay first generation or your second generation? Nurses, focus po tayo ngayon dito sa inyong antipsychotic or your neuroleptics. Bingo! If the medication, nurses, ends, okay, again, if the medication ends in your ZIN, tandaan mo lang, that is your first generation conventional antipsychotic medication. An example of that one, nurses, that is your chlorpromazine. Another one, that would be your thorazine. Lahat ng gamot in psychiatric nursing, nurses, ending in your ZIN, that is your first generation dopamine antagonist. It will now elevate the positive symptoms. Yes or no? Yes. If that is second generation naman po, my dear top-notchers, tandaan nyo lang po ang sinabi ni Sir Ken. Ano po yung sinabi niya? That is now the medications ending in pin and done. Again, these are your medications now ending in pin and done. Sir, example po. One is your clozapine. Another one, nurses, that is your olanzapine. Another one, that is your olanzapine. Ano yung olanzapine? Yung kinakain mo na kulay violet. Zapin. Charot lang. Okay. What else, nurses? We have your done. Sir, ano ba example ng done po natin? We have your risperidone. We also have, nurses, your ziprasidone. Nurses, sorry lang, wait lang po ha. Meron pong nag-chat dyan ng, sige, mamaya na po yun. Okay, sige po. Go. Again ha, ZIN, first generation, second generation, pin and done. Except for two, nurses. Tandaan mo yung dalawa na exemption natin. And that is your ML. Sir, ano po yung dalawang exemption namin dito? ML, your mobile legends. Yes or no? Yes. And that would be, nurses, your molindone and your loxapine. Bakit po? They end in your done and pin. However, they are under your first generation conventional antipsychotic medication. All medications ending in pin and done, like your clozapine, olanzapine, risperidone, and your ziprasidone, are now second generation antipsychotic medication. Sir, nasaan po ngayon si haloperidol? Bingo, nurses, very good question po sa tanong, nasaan po si haldol at si haloperidol? Sige po, tandaan mo lang, si haloperidol, that is also your first generation antipsychotic. Again, your haloperidol, nurses, or your haldol, please remember, bakit po siya hinuli ni Sir Ken? Because haloperidol, this is your high potency. Again, this is your high potency first generation conventional dopamine antagonist antipsychotic neuroleptic. Again, haloperidol, that is first generation high potency po natin. Sir, ano pa po ang pagkakaiba ng first at second generation po natin? Bingo, if asked in the board examination, for example, your patient now is having signs and symptoms or signs of your extrapyramidal syndrome, which we are going to discuss later. Ilagay mo na po dito, ilagay mo na ngayon din, ilagay mo po dito, less po, less incidence of your EPS if your patient now is taking your second generation atypical neuroleptic antipsychotic po. Sir, ano po yung EPS? I-discuss po natin yan mamaya. Okay? Tandaan mo lang ngayon, ang gusto ko lang tandaan mo ngayon, nurse. First generation, Zin. Second generation, Pin and Done, less ang side effect po natin. And your haloperidol, that is first generation. Ano yung dalawang exemption natin? Your ML, your Molindone, and your Loxapine. This is the first and the second generation. But hey, top-notchers, if you are going to check now, the latest edition of the Book of Videback, meron na po siyang third generation antipsychotic medication. Sige po, nurses, i-clear ko na po yung slide po natin. You may screenshot in 5, 4, 3, 2, and 1. I'll be moving now to the next slide. If asked now, what would be the best antipsychotic medication, nurses, that would now be the third generation antipsychotic medication po natin. Ano po to, nurses? Yung third generation antipsychotic medication natin, this will now be your dopamine system stabilizer. Again, third generation medication, nurses, this is what we call now your DSS, your dopamine system stabilizer. Sir, ano po ang ginagawa ni dopamine system stabilizer po namin? Si first generation, binabagsak niya or pinapababa niya ang inyong dopamine. Si second generation, pinapababa niya ang inyong dopamine and your serotonin. Yes or no? Yes. Ano naman po ang ginagawa ni dopamine system stabilizer? If dopamine, nurses, is high, pinapababa po niya ang dopamine. If dopamine, nurses, is low, pinapaakyat naman na po niya ang level ng dopamine. Therefore, nurses, preventing your side effect of your medication. Bakit? Pag nagbigay ka, nurses, ng dopamine system stabilizer mo, pwedeng bumagsak ngayon ang level ng dopamine ng patient mo, pwede siyang magkaroon ngayon ng EPS, pseudoparkinsonism, etc. Yes or no? Yes. However, your DSS now, your third generation, it balances now the level of your dopamine. If it's too high, pinapababa niya. If it's too low, pinapataas niya. Yes or no? Yes, sir. Ano naman po ngayon ang example ng ating third generation antipsychotic medication? Bingo, put a big star, nurses. Pag first generation, sabi natin, that is your Zin. Yes or no? Yes. Pag second generation, that is your Pin and that is your Done. Yes or no? Yes. Tandaan mo naman, nurse, pag antipsychotic third generation, dopamine system stabilizer, that will now be the medication ending, nurses, in your Zol po. Again, that would be the medication now that is now ending in your Zol. Very good po, ma'am. That is now your aripiprazole. Example, nurses, that is your aripiprazole. Another, that is your brexpiprazole. Okay po tayo dyan, ha? This is your third generation antipsychotic. Less po ngayon ang mga side effect niya. Yes or no? Yes. Sir, ano lang yung mga common na side effect po ng antipsychotic namin na third generation or your dopamine system stabilizer? Nurses, that would now be your sedation and that is your nausea and vomiting. Ayan, may sinasabi po dyan pantoprazole. Okay, pantoprazole and your omeprazole, nurses, sa GIT po yon. Okay, that is your proton pump inhibitor naman po yon. That is for your MS. Yes or no? Yes, you are in your psychiatric nursing. Yes or no? Yes po. Again na, omeprazole, pantoprazole, that is your proton pump inhibitor. Kayo talaga, mga loko-loko. Go. Again na, aripiprazole and your brexpiprazole. Okay? Walang sasagot ng pantoprazole at omeprazole, ha? Kukurting ko talaga yung mga singit ninyo. God. Nurses, sir, what if yung patient namin ngayon may hindi nagtitake ng kanyang gamot? Again, the question, sir, yung patient hindi nagtitake ng gamot, tinitigil niya. Okay, bingo, Please remember this one, nurses. We have what we call now, if the problem, for example, nurses, there is a problem with compliance. Ibig sabihin, nurses, yung patient mo, hindi siya nagtitake ng kanyang gamot dahil may mga side effect na ayaw siya. Yes or no? Yes. Ulitin ko ha, if there's a problem with compliance, ito lang po ang hanapin ng mga top notchers ng TopRank Review Academy. Hanapin mo lang, nurse, ang word na decanuate. Again, you just look for the word, nurses, decanuate. Sir, saan namin hanapin yung word na decanuate? Nakalagay po doon, fluphenazine decanuate or chlorpromazine decanuate or aripiprazole decanuate. Nandun siya, nakahalo sa pangalan ng gamot. Why? Your decanuate, nurses, that is now your long-term effect. Ibig sabihin, matagal po yung effect ng inyong medication. Sir, how long is how long? Pag ang patient mo, for example, nagtutake na siya ng inyong decanuate, the patient will just take your IM or IV decanuate. Ita-take lang po niya yan. Please remember, sa ko po isusulat, dito na lang po. That could only be once a month, pwede na po siya. Again, that could only be taken or that could be taken for only once a month. So kahit hindi na mag-take araw-araw ang patient mo ng gamot, yes or no? Yes, mag-take na lang siya ng decanuate. Once a month lang siyang i-injectan IM or IV. Yes or no? Yes, nurses. Please remember the word decanuate for your long-term effect given if the problem is compliance. Nurses, pakidagdag na rin po dyan if the problem is memory, for example. Baka yung patient mo matanda na. Baka makalimutan na mag-take ng kanyang gamot. Pag ganon, bigyan mo na ng decanuate. Why? Long-term effect. Yes or no? Yes po. Okay? Sige po. Clear ko na po ha. Clear ko na po in 5, 4, 3, 2, and 1. Again, your zinpindone and your zole. Okay? Sige po. Your decanuate for long-term if may problem sa inyong compliance. Okay? Sige po. Sir, let's have now the side effect of your antipsychotic medication. Go. For the side effect, nurses, please remember, this is more on your anticholinergic side effect. Now, please remember, nurses, the demonic, okay? And that would be your PS cat dog. Again, the mnemonic, please remember, nurses, that would be your PS cat dog. Sir, ano po yung mga PS cat dog po namin? Yung mga side effects po namin na common. Again, these are the common side effects. 1, we have your photosensitivity. What else, nurses? We have your sedation. Another side effect, sabi ko kanina, anticholinergic, ibig sabihin tuyo ang patient mo. Yes or no? Yes. Ilagay mo po dyan, nurses, constipation. What else, Sir Ken? That is your agranulocytosis. Again, that is your agranulocytosis. Another, letter T, that is your, okay, tooth decay. What else po? Letter D, that is your dry mouth. Again, that is your anticholinergic. Yes or no? Yes. Another one, we have, nurses, your orthostatic hypotension. Again, we also have your orthostatic hypotension. And last, nurses, we have your galactorrhea. Sir, is the Board of Examiner will be asking that to us? Yes. But hey, anong itatanong nila? Baka hindi po to. The Board of Examiners might ask you, the patient, for example, is taking now your antipsychotic medication. Which of the following patient education must be given? Or which of the following information must be included in the teaching plan of a patient taking your antipsychotic medication? Ganun po siya tinatanong sa board exam. Yes or no? Yes. At ito po ang mga sagot na hahanapin nyo sa board exam. Yes or no? Yes. If the Board of Examiner asks you, which of the following interventions or which of the following education must be included in the what? Patient instruction for patient now taking your neuroleptics. Go. Isa-isahin po natin. Okay? Let's have 1, photosensitivity. Bingo. 1, that is now no exposure or avoid exposure to sunlight. Again, nurses, avoid exposure to sunlight. Or you use your SPF 25 or above. Okay? Meron po ba tayo nurses sedation? Yes or no? Yes. Idagdag mo na po dyan, nurses, avoid or caution in driving. Again, caution in driving or operating machineries. Again, this will now be included, nurses, in your patient education po for patients now taking your antipsychotic medication. Sir, what else? Meron po ba kaming constipation? Yes or no? Yes. Bingo. Idagdag mo dyan, nurses, increase fluid intake plus increase fiber in the diet. Hey, hindi na po masyadong ginagamit ang fiber ngayon. Yes or no? Yes, obsolete na po yan. Ano na po ang ginagamit? It's either high roughage or your high residue diet. That is same with your high fiber diet. High roughage or high residue diet. Nurses, meron po ba tayong agranulocytosis? Yes or no? Yes. Bingo. If asked in the board examination, nurses, which of the following laboratory must be recorded or must be assessed or must be monitored in a patient now taking your neuroleptic medication? That will now be your WBC. Yes or no? Yes. Why? Because a granulocytosis or a decrease in the level, nurses, of your WBC, that will cause now the patient prone to infection. Yes or no? Yes. Again, the patient is prone to infection. Which of the following laboratory must be monitored if the patient is taking neuroleptics? Bingo, the answer would be WBC. But if the question is, which of the following instructions must be given by the nurse to the patient taking your antipsychotic medication? Ito po ang ating alternate answer. That is now to instruct the client to report sore throat and fever. Why? Sore throat and fever are signs of your infection. Yes or no? Yes. So that would now be one of the most important instructions that you're going to give if your patient now is taking your neuroleptics. Report signs of your infection. Plus avoid people, avoid many people, avoid fresh flowers, avoid fresh fruits, etc., etc. to prevent now your infection. Sige po. Nurses, may dry mouth po ba? Yes. Pero meron din po bang tooth decay? Yes or no? Yes. Ilagay mo po dyan, nurses, to stimulate salivation. However, preventing now your tooth decay, that is now your sugarless, hard candy. That is now, nurses, to prevent now your dry mouth while preventing as well your tooth decay. Sir, meron po ba kaming orthostatic hypotension? Yes po. Therefore, one of the nursing education included, nurses, that is now to instruct the client, okay, to change position slowly. Or change position from sitting to standing position slowly. That is now, nurses, to prevent your patient from having hypotension, to prevent, nurses, your dizziness. Yes or no? Yes po. And one last, nurses, meron po ba tayong galactorrhea? Yes or no? Yes. What is galactorrhea? Ang babae ngayon nagkakaroon ng mga secretions, milk production. Yes or no? Yes. Because your neuroleptic medication, nurses, that increases the production of your prolactin. Kaya nagkakaroon ka ngayon ng yung galactorrhea. Sige, ilagay mo lang dyan, use cotton underwear. Bakit po cotton underwear, nurses? That is just to absorb now the milk production. Yes or no? Yes. Nurses, one last time. What are the side effects or common side effects now of your antipsychotic or neuroleptics? We have your PS cat dog, photosensitivity, sedation, constipation, agranulocytosis, tooth decay, dry mouth, orthostatic hypotension, and your galactorrhea. Ask by the Board of Examiner, what laboratory value are you going to monitor? Alam nyo na, the answer is WBC. Yes or no? Yes. High fiber or low fiber? High fiber dahil may constipation. Yes or no? Yes. Sun exposure or avoid sun exposure? Avoid sun exposure. Why? Merong photosensitivity. Yes or no? Yes. Will you report sore throat and fever? Yes, because the patient now is prone to infection. Yes or no? Yes, because of your agranulocytosis. Nurses, Again, these are the common side effects of your antipsychotic and your neuroleptic medication. Okay? Sige po. Nurses, screenshot nyo na po. Ililipat na po natin in 5, 4, 3, 2, and 1. Again, nurses, these are the common side effect. Okay. Nurses, let's have another side effect po. Nurses, please remember, we have what we call as well as your EPS. Sir, ano po yung EPS po namin? Your EPS, nurses, please remember, that is your extrapyramidal syndrome. Again, EPS, that is your extrapyramidal syndrome. And this is composed, nurses, of 3 distinct manifestations. Again, this is composed of 3 distinct manifestations. Kaya po siya tinawag na extrapyramidal. 3. Yes or no? Yes. Nurses, tandaan mo naman dito, tandaan mo po ang word na DAP. Okay? Tandaan mo po ang word na DAP. Alright. Sir, ano po yung DAP? Wait lang ha, isulat ko dito ang inyong DAP. Sir, ano po yung DAP naman sa inyong EPS? Ang dami naman, sir. Okay? Ganun talaga. Okay? Go. 1, nurses, we have your dystonia. Sir, what is dystonia? That is your uncontrollable muscle contractions. Again, dystonia, nurses, that is your uncontrollable muscle contractions. And hey, nurses, please remember, under your dystonia, meron din po tayong 3. Okay, ano na po yung 3 natin under your dystonia? Ilagay po natin dyan, nurses, go. Ilagay mo dyan ang dot. Again, pakilagay po dyan ang dot. What is dot, nurses? Number 1, there is dysphagia or difficulty swallowing. Yes or no? Yes, because of the controllable or uncontrollable muscle contraction. What else, nurses? We have your oculogeric crisis. Again, we have, nurses, your oculogeric crisis. Or yung mata ng patient mo, bigla siyang tumaas. Yes or no? Yes, that is the upward deviation of the eye. Nakatingin na lang sa taas. That is your oculogeric crisis. And last, nurses, letter T, that is your torticollis. Sir, ano naman po yung aming torticollis? Bingo, that is now your stiff neck. Again, EPS, your DAP. Dystonia, ang letter D, under letter D, we have your dysphagia, oculogeric crisis, and your torticollis. Sir, ano ngayon po ang management po namin? Pag ang patient ko, for example, ay may dystonia. Bingo, tanda mo naman dito, nurses, ang ABC. Ang dami naman yan, sir. Ang dami-daming letters. Ganun talaga. Okay? Sige po. Ano naman po yung ABC natin, nurses? 1 is your akineton. Next is your Benadryl. Another is your Cogentin. Okay. Sir, ano po yung ating mga generic name? Remember, binibigay nila usually is your generic. Yes or no? Sige po. Akineton, nurses, akineton, this would be your piperidine. Benadryl, that would be your diphenhydramine. Your Cogentin, nurses, that would be your benztropine. All of these, nurses, can be given to your patient with dystonia. Sir, are we done with dystonia? Yes po. What is letter A naman po, Sir Ken? Bingo, that is your akathisia. Sir, ano naman po ngayon yung aming akathisia? Tandaan nyo lang to ha. Akati, 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 nangangati, 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 hindi mapakali, that is your akathisia. Ulitin ko. Akati, 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 nangangati, 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 hindi mapakali, that is your akathisia, that is your restlessness. Or, ipalagay mo po dyan, nurses, put a big star. If the patient, for example, cannot sit still, bingo, that is already a sign that the patient is developing your extrapyramidal syndrome. Yes or no? Yes. Ano pong sabi ni Videback sa kanyang libro, nurses, anong ibibigay mo? Pag ang patient mo ay may akathisia, you give your propranolol. Again, nurses, you are going to give, nurses, the patient your propranolol naman po. And last, nurses, letter P. What is that one? That is your pseudo-Parkinsonism. Again, your letter P, nurses, that is now your pseudo-Parkinsonism. Again, that is your pseudo-Parkinsonism. Sir, bakit nagkaroon ng pseudo-Parkinsonism? Because sabi natin, mataas ang inyong dopamine sa psychiatric nursing or sa schizophrenia. Are you going to give drug now to decrease the dopamine? Yes or no? Yes. Ano pong sabi ng lecture po natin ng neuro? Pag nag-decrease ang dopamine, magkakaroon ka ng Parkinson's disease. Yes or no? Yes. Bingo. That is why your patient now taking your antipsychotic, particularly your first generation conventional antipsychotic medication that will have now your pseudo-Parkinsonism because of the decrease in the level of your dopamine. Ano naman po kayang manifestation natin dito, nurses? Nagkakaroon po tayo dito ng inyong mask-like facies. Again, nagkakaroon po tayo ng mask-like facies. Ang mukha ng patient mo, hindi gumagalaw. Yes or no? Yes. Another one, that is now your muscle rigidity. Nahihirapang gumalaw ang patient mo. Plus your tremors. Yes or no? Yes po. Lahat po yan ay under your pseudo-Parkinsonism. That is why, nurses, you are going to give naman a medication to increase the level of your dopamine. Yes or no? Yes. And that is now your anti-Parkinsonian medication in the name of your amantadine simetrel. Yes or no? Yes po. Again, that is your dopamine agonist. That is your amantadine simetrel. Nurses, this is the concept of your extrapyramidal syndrome, your dystonia, akathisia, and your pseudo-Parkinsonism. Tanong ngayon ng Board of Nursing, the patient now, for example, upon assessment, the patient is already manifesting restlessness, ocular crisis, and rigidity. What should be the immediate action of the nurse? A, discontinue the medication, or B, report to the physician? Okay, answer. Nurses, I would like to get your answers. The question of the board exam, the patient now is experiencing ocular crisis, restlessness, and rigidity. Which of the following must be the first action of the nurse? A, are you going to immediately discontinue the drug? Or B, are you going to report it to the physician? Discontinue or to report? Sige po. Ayan, nagsipasukan na po ang mga sagot sa ating Zoom at sa ating Facebook Live. So both merong sumagot ng A at merong sumagot ng B. Yes or no? Yes. Bingo. Nurses, the correct answer, pakilagyan na po ng malaking star dyan para hindi mo makalimutan. If there is EPS, nurses, the correct answer is to report to the physician. Again, nurses, report to the physician and do not continue the drug immediately. Again, do not discontinue the drug immediately. Why, sir? Bakit hindi pwedeng discontinue? Remember, nurses, antipsychotic medication, dapat tuloy-tuloy ang pagtitake mo ng gamot mo. Yes or no? Yes. And that is now, nurses, pakilagay po dyan, that is now to prevent relapse. Again, nurses, that is now to prevent relapse. Ulitin ko, nurses. Ulitin po ni Sir Ken. Basta extrapyramidal syndrome, dystonia, akathisia, pseudo-Parkinsonism, what is the initial action of the nurse? Report to the physician. Because the physician will adjust the dose of the medication or will give another medication. But the patient is not allowed to discontinue taking the medication agad-agad because that will cause relapse. Baka ang patient mo biglang magkaroon ng hallucination, biglang magkaroon ng delusion. Yes or no? Yes. Bakit? Itinigil mo ang kanyang antipsychotic medication. Yes or no? Yes. Nurses, that is the concept of your extrapyramidal syndrome. Is that clear? Sige po. Sir, yan lang po ba? Meron po tayong isa. Okay? Sige po. Nurses, you may take a screenshot of the lecture. I'll be moving on to the next slide in 5, 4, 3, 2, and 1. Nurse Ken, nurses, top notchers, again EPS, report to the physician, do not discontinue. Go. But if asked nurses in the board examination, sabi ng BON mo, what is the most fatal side effect of your antipsychotic medication? Ano po ang pinaka nakakamatay na side effect, nurses, ng inyong antipsychotic medication? Please remember, nurses, that would be your NMS naman. Again, that would be your NMS. Anyway, this is now your pseudoparkinsonism, dystonia, and your oculogeric crisis po. Okay? Sige po. Again, this is your EPS. Sige. Let's have nurses. If the Board of Examiner now asks you, what is the most fatal side effect or pinaka-nakakamatay na side effect ng inyong neuroleptic medications? That is your neuroleptic. Okay? That would be your neuroleptic malignant syndrome. Sir, paano namin ngayon malalaman na ang patient namin ay meron ng neuroleptic malignant syndrome? Bingo, put a big star if there is already fever plus muscle rigidity. Again, if there is already fever and muscle spasms, nurses, that is already your neuroleptic malignant syndrome, and that is considered, nurses, as the most fatal or pinaka-nakakamatay na side effect ng inyong antipsychotic medication. Lagay mo na po dyan, nurses, most fatal. Sir, can we prevent your neuroleptic malignant syndrome? Yes or no? The answer, my dear top-notchers, that would be yes. Sir, how can we prevent your NMS? Put a big star. That is simply to hydrate the patient. Again, that is simply, nurses, to hydrate the patient. Question. Sabi ni Sir kanina, pag may EPS extrapyramidal syndrome, report to the physician. Yes or no? Yes. Question naman po ngayon dito. If the patient, for example now, ang sabi ni board examiner, the patient who is taking, for example, your clozapine, has high fever and muscle spasms, which of the following now would be the immediate action of the nurse? A, discontinue the medication, or B, notify the physician? And what would be the answer now of our top-notchers? A or B? Are you going to discontinue or are you going now to notify the physician? Okay, sa Zoom po natin, nagsasagutan na po, notify pa rin, immediate action, discontinue the medication. Okay, may sumagot ng A, may sumagot ng letter B. Yes or no? Yes. Okay po. How about po sa ating Facebook Live? Okay, may notify the physician. Okay, meron din. What else? Meron ding discontinue. Okay, nurses? Put a very, very big star para hindi na po makalimutan, nurses. Ayan po. Pabaon ni Sir Ken sa inyo sa board examination, a very big star. If that is EPS, nurses, dystonia acanthatia tardive, dystonia acanthatia and your torticollis plus your pseudoparkinsonism, notify the physician. Yes or no? Yes. But if that is, nurses, your neuroleptic malignant syndrome, nakakamatay po ba yan? Yes or no? Yes. Bingo. The management or the initial action of the nurse, that will now be to discontinue the medication immediately. Yes or no? Yes po. Why should you discontinue, nurses, immediately the medication? Okay lang. Kahit magkaroon na ng hallucination, okay lang mag-hallucinate, okay lang mag-delusion ang patient mo, wag lang siyang mamatay. Yes or no? Yes. Anong unahin mo? Delusion or ang pagkamatay ng patient mo? Siyempre, piliin mo na lang ang delusion. Yes or no? Yes. So correct answer, nurses, pag NMS po, that is most fatal na nakakamatay, discontinue mo na kaagad. Hindi na balay mag-relapse, wag lang mamatay ang patient mo. Yes or no? Yes. Because your muscle spasm, nurses, this can lead to your laryngeal spasm. Yes or no? Yes. At pag nagkaroon, nurses, ng laryngeal spasm, will that obstruct the airway? Yes or no? Yes. Hindi makakahinga ang patient mo, tigok ang patient mo. Yes or no? Again, EPS, report. Pero pag NMS, discontinue immediately. Okay po tayo dyan, ha? Go. Clear ko na po, ha? Clear ko na po. In 5, 4, 3, 2, and 1. And last, nurses, before we end this discussion, pinakalas na po. Pag tinanong ka naman, what is the last side effect of your antipsychotic medication, nurses? That would be your TD naman po. Okay, so this is your NMS. If the question of the board examination naman, what is the last side effect, nurses, of your antipsychotic medication? Bingo, that would be your TD, and that is your tardive dyskinesia. Again, nurses, the last side effect of your antipsychotic medication, that is your TD or your tardive dyskinesia. Pabaon po sa inyo ni Sir Ken sa inyong actual board examination. May nakita ba akong nag-comment na Madam Veronica? Sino yon? Okay, go. Diretso po tayo. Tandaan mo, nurses, ang malaking letter T po dito sa inyong tardive dyskinesia. Go. Malaking letter T sa inyong tardive dyskinesia po. Wait lang, let me check lang po yung mga friends po natin dyan sa Zoom. May nag-chat po. Go, nurses. Tardive dyskinesia. If your EPS has dystonia, akathisia, and your pseudoparkinsonism, report immediately. And your NMS, your neuroleptic connected syndrome, has fever and your muscle spasm. Your tardive dyskinesia naman, nurses, please remember, your patient now will be exhibiting one. There is teeth grinding. Again, number one, there would be teeth grinding. Another one, nurses, there would as well be tongue twisting. Okay, that will be tongue twisting. And last, there will be tongue protrusion. Again, there will be, nurses, tongue protrusion. Sabi ko kanina, nurses, is this the last side effect that your patient can have if he or she is taking now your antipsychotic medication? The answer is yes. Yes or no? Yes. Sabi ko kanina, it is the last. Sir, bakit po siya last side effect? Because your tardive dyskinesia, nurses, please remember, that could only occur now after 6 months of taking your antipsychotic medication. Again, that could only occur after 6 months of your antipsychotic medication. And hey, ilagay mo na rin po dyan letter L. Idagdag mo po dyan, ang patient mo pwede rin magkaroon ng lip smacking. Again, the patient could have your lip smacking. Nurses, if asked now in the board examination, which of the following side effects of patients now on taking your antipsychotic drug is permanent or irreversible? Bingo. Put a very big star. That would be your tardive dyskinesia. This would now be your permanent side effect to the patient. Ibig sabihin, it is irreversible. Yes or no? Yes po. Sir, tardive dyskinesia. EPS, we are going to what? Notify the physician. Tama? NMS, we are going to discontinue the medication. Paano naman po pag tardive dyskinesia, nurses? That is also, sige po, lagay mo na po dyan, management, that is also to report to the physician. Nurses, sino lang ngayon i-discontinue mo? I-discontinue mo lang medication pag NMS na. Kasi NMS, yan po ay nakakamatay. Yes or no? Yes. But aside from NMS, nurses, other side effect po, you need to report to the physician and never ever discontinue the medication to prevent your relapse. Is that clear, nurses? Malinaw po ba ako dyan? Okay po tayo dyan, ha? Go. Sige, nurses, that is now the last side effect of your antipsychotic medication po. Okay? Sige, nurses, it's already 8 o'clock in the evening. Okay, so this is the last side effect and this would be the last part now of our free lecture. I hope you learned something from me today, nurses, and I hope magamit nyo po yan pagdating po ng inyong board examination. Okay, nurses? So, before anything else, I would like to thank every one of you sa pag-participate po sa lecture natin. Thank you for staying with me for 2 hours. Alam ko medyo nakapagod na gabi na pero nag-stay pa rin kayo with me for 2 hours. Maraming salamat po. Okay? Sige po, nurses. Again, nurses, to those who are of you na hindi po na po nakapag-enroll sa TopRank Review Center, you may directly enroll po. Mag-chat lang po kayo sa fan page po natin. We are still accepting enrollees po for the final coaching that will be starting on June po. Alright? Then again, sa mga hindi po nag-enroll, kindly, to all the viewers po, to all the participants, kindly like and share up the page po of TopRank Review Academy.